Great to see you.
Of course, you too.
Thank you so much for having us.
You're welcome. Thanks for being here.
Absolutely, we wouldn't have missed it. This is one of those meetings that people circle on the calendar.
Yeah, I tell you, we've gotten on the map the last 10 years. It's our 10th anniversary of ISDS. International Spinal Deformity Symposium is a mouthful, so ISDS has been the abbreviation that's caught on and it served us really well. So we've been now in New York City for 7 straight years. Right, many meetings that are run in New York City because it's really hard and very expensive. But thankfully, we have very committed faculty, attendees, and industry partners who can allow us to, make this meeting a reality in New York City in early December, which is again is especially a difficult time because it's a popular time to be in New York City.
Yes, it is.
We're making it happen, and I just ran around and I talked to every single industry partner. They've had a great meeting here, and they're getting their ROI, speaking to surgeons and making sure that they understand what's available and new technology and things like that. And talking to all the attendings, everyone feels this is really the meeting to be for boutique adult spinal deformity care from a non-society perspective. We're not trying to be the SRS or IMAS or any other society-based meeting, but for a non-society-based meeting, we think this is the place to be if you really want to get the best education on adult spine deformity.
That seems to be overwhelmingly, there's so much to be learned here. To the point where, yes, the meeting's intimate, there's a lot of good conversations. They want to get in there and learn.
Right. And you know why? There is so much to learn. I've been doing this 33 years now, treating adult spinal deformity. I've learned so much in the last 2 days. It's incredible.
Wow.
So imagine the junior surgeons who are just starting their practice. We were talking about this last night at the faculty dinner, and I mentioned this, the co-faculty. I think that the challenges of preparing, performing, and recovering an adult with a severe spinal deformity, the processes involved in that are as great as anything in healthcare besides maybe heart-lung transplant surgery or some very esoteric things that obviously are very medically complex. But this is very complex planning, preparation, surgical execution, recovery. I mean, it's a handful. It's a lot. And that's why we have so much to learn. We're still at the tip of the iceberg. We're getting better. We're making small incremental improvements in all aspects of care. But because there's so many variables involved in all this, it's taken a lot. And but this is why we have the meeting. That's why people want to come, because if you're dedicated to treating these patients and want to do your best, you've got to be state of the art. Every year, this meeting provides new information on every single topic, not just one topic. That's why we can run it yearly. So it's really impressive.
It's almost like this just base or ground level for innovation in the space, because it's surgeon conversations.
Innovation and patient preparation. We're innovating in how patients are being prepared for surgery. I mean, their analysis, their preparation, the planning the surgeon's doing. I mean, I'm planning 3 times longer for surgery than I did 10 years ago. Because I have to. Why? Because we have to get the alignment of the spine perfect. And that takes a lot of planning, let alone surgical technical execution. In the OR, we got to meet our plans. And that's not easy sometimes. We have people treating people, and that's not a perfect science. That's not automated technology there, right? But we're getting there slowly with time, and then we got to take care of these patients post-op forever. You never not take care of a patient having a large, extensive spinal deformity surgery. I mean, you're really you're partners for life, and it's a great responsibility. It's a great interaction, and it's an honor to take care of these people. But it's a big commitment. And we all realize that, but I think we're realizing it's almost a greater commitment than anyone ever thought. Certainly, than I ever thought when I started doing this 33 years ago.
So, thanks for sharing that. What I'd love to hear is, there's a lot of fellows, residents here. Some are yours, right? Some are some of the other faculty members.
Of course.
Can you talk about the importance of education at their stage? And you seem to pour so much into your fellows and residents.
Yes, as I tell people, I can only treat one spinal deformity patient at a time, right? But if I can help educate, especially our younger generation who are going to take over for me sooner than later. I mean, I'm certainly, after 33 years, more at the tail end of my career than the early part of the career. I can make a big difference, a bigger difference from that perspective than even the patients I treat individually. So as I get more senior in my career, I actually am gearing more of my time and energy towards education of the next generation, because I can make a bigger impact, exponential impact. We all can.
We all can.
It makes sense.
It does. I'll never forget this moment. This is several years ago, but when you unveiled, I believe, for the first time your kickstand technique,
Right.
I saw hundreds of surgeons pulling out their phones like paparazzi because it was
I
this
remember
brand new thing. Well, because I was in the audience and you were presenting it, but it was just a moment.
I thought we were just checking an email.
Everybody,
or text or
or
whatever.
iPads. I mean, it was just one of those things. It's just like, do you ever think about your impact, whether it's fellows or on these technological little nuances to the procedures that you've done? I mean, there's instruments named after you. I mean, it's
No, I don't
do you
dwell
think
on
about it
that.
like that?
No, not at all. You know why? Because this is a humbling profession. I've got a patient now in the hospital. But actually, right after I finish this conference, I got to go see. She's having a progressive loss of motor function in her leg, and I don't know why. So we're ordering studies right now. I'm going to go see her. It's a Saturday. I'm Saturday at 5, 6 o'clock. I'm going to be seeing her, evaluating her, figure out if I need to take her back to surgery this weekend. So that's what I'm worried about, honestly, right now. I'll leave that to later. Deep down inside, the time you mentioned it. I mean, of course, who wouldn't be proud of that? I don't have time to dwell on that right now. And that's for other people to decide, right? I'm just trying to do the best I can for my own patients and to help others take care of their patients and let the chips fall where they may.
Love that.
Honestly.
Well, in terms of this meeting, obviously 10th annual, it's awesome.
Right.
There's also kind of a sister meeting
Right.
that's happening in Vail not too
Exactly.
long from now. Can you
Right.
talk a little bit about
Yeah,
some
so
masters?
actually, Jeremy Longhurst Broadwater was the one who really came to Chris Shaffrey and I 3-4 years ago saying, actually what happened was the Spine to Summit meeting, so Base to Summit meeting in Vail, that actually was pathway for a few years, is a meeting of all spine surgery topics, which is really a great meeting. I mean, I love the meeting. Also in Vail, but what we were getting recommendations from the attendees that they wanted more deformity content into it. But again, some of the people who only did cervical surgery wanted more, so it was basically becoming too much. And as you know, all spine surgery is becoming subspecialized in a greater degree, and especially spine deformity. So Jeremy, in his wisdom and experience, asked Chris and I if we wanted to kind of take a big portion of deformity out of Base to Summit and take it to a new meeting called Spine Masters and Spine Deformity, which we did, still in Vail. Run it 2 years in a row now, extremely boutique. Basically 40 attendees.
Wow.
10 faculty, 30 surgeons, 20 early career years 1 to 3. And for the early career surgeons, you have to submit a list of cases that we select for you to present, and we go over.
Wow, like a grand rounds at
like
the meeting.
grand rounds, basically, but peered by 10 of your senior colleagues that are in the room, in a very professional way. But we're kind of helping them get better. But it's still a great idea, a great meeting. But again, that has some bandwidth to grow. We're actually almost at wit's end here. We were oversubscribed this year with attendees. We were almost outgrowing this convention center, which we enjoy. It's really a perfect size, and for a lot of reasons we want to stay here. But so what we're going to do is kind of leverage and kind of marry these meetings closer together, that we can slowly increase the attendance and bandwidth of that meeting, and maybe even make a prerequisite for the early surgeons to kind of attend that meeting, and then being allowed to come here, because we have to somehow, we're going to have to cap registration here probably next year actually. We don't like doing that, but I think that's one way of maybe controlling attendance here, is have maybe the more junior surgeons kind of attend that meeting first, and then consider coming here second. So we're thinking outside the box a bit. And this is actually just in the last hour or two that we've discussed this, but we're going to marry these two meetings together in a closer relationship, also for industry support. We have industry supporters that can't even get in here because we're oversubscribed. There, we're kind of we would need a little bit more help. So we're going to, again, maybe marry those two together from a support perspective too. So many ways I think we can leverage kind of the best of both meetings to make both stronger, in other words.
So help me understand. So I love that. It's a great mission. I mean, this is very intimate. You don't want this to get too big.
Right.
You like the convene. You like New York City.
Exactly.
Right.
This time of the year, right?
This time of the year.
Right.
But the Masters is designed for those,
more early career surgeons.
career.
Right. Where more technique-based things, so make sure that you have your techniques down, because again, if you have all the best planning, all the best care, but your techniques aren't good,
Yeah.
you're not going to have a good outcome, right? We know that. So, but in early surgeons that's when you really are impressionable to get your techniques down solid, right? All these other kind of multidisciplinary care factors can be added at any time, but if you're not technically doing a good job, and I don't care what kind of care you have before or after, you're not going to have a good result, right? Every deformity surgeon knows that. So focus on getting your techniques down solid as a foundation early on in your career. And this spine master's meeting in deformity can help you do that. Then you graduate and look at the esoteric things of how to get your patients best prepared for surgery and post-op care and all these other things that are very important as well, but are more ancillary. That makes sense.
It does. That's a great, I mean.
So we'll see. Well, again, this is all preliminary. Please don't, this is not subscribed yet, but it makes sense to me. And again, Chris Shaprey, Frank Schwab. Actually, Chris Shaprey and I started Spine Master. We're going to add Frank Schwab. So we're going to actually, three of us are going to co-chair both meetings. Oh, wow. We just agreed on. And we're also going to form well, hopefully we're going to call it the Spine Deformity Education Foundation, and create a foundation basically where companies can help us support both meetings, and that's really education in spine deformity going forward. I personally am going to support it. So we're thinking outside the box. Really, I want to build something that's sustainable, long term. So when I'm kind of past my days of educating, that this foundation and these two meetings will supersede and just carry on hopefully autopilot with obviously the next generation, the co-directors, Lehman, Smith, Hanjo Kim, and Mike Kelly can lead the charge. What a vision! So we're going to put this in a great position, so they better not mess it up. That's my point. And they won't, obviously.
They won't. It's, I mean, again, just going back to having a chance to speak to some of your fellows here in this chair, and just getting their perspective on having such a well-rounded approach to getting in your OR, Dr. Lehman's OR, like the difference, the nuances there. It's almost like a microcosm for the whole deformity community, because you have enabling technologies, and you have
the more traditional techniques. They need to know how to have mastered as well. Right, exactly. And we complement each other quite well. That's why our fellowship is quite popular for that. And we also have, they work with Dan Roos, so they get incredible experience in the cervical spine, and they work with our neurosurgeons. They do intradural work that I don't even do. I mean, so it's really a pretty comprehensive fellowship. But yeah, you're right. I think Lehman, and although I train him, and he's obviously been with me for a while now, he's definitely gone his own pathway, which is just phenomenal. With much more enabling, which is, again, obviously the younger surgeons absolutely have to master that now. But, you still need to understand how to do things, a little bit more traditional freehand methods, because sometimes enabling technology it doesn't work perfectly every time. Probably, maybe I can't say that 10 years from now.
Right, but
now it's still just like on, my auto drive car come down West Side Highway. I mean, it works 99.9% of the time, but I still pay attention.
Yes, sir.
I still hold on to the steering wheel, right? So that's my point. So, but then again, maybe 10 years from now we won't have to do that, but we still do. Same thing as spine deformity surgery, right? So that makes sense. So you have to know both right now, and you get trained in both. You can always kind of exit out whatever you want.
I love that.
So
I'd love to hear your perspective on what's next in deformity surgery.
Right. So what's next in deformity surgery, I think, is continued use of big data and analysis of that big data, not just in radiographic big data, which is currently being done, but clinical big data, patient preparation big data, genetic analysis big data, telomere length. I mean, I think, again, as I said, these are such complex patients. We just need the most amount of data on them as we can obtain to be analyzed. We have a computer science scientist that helps us with our machine learning algorithms. Now we've done a bit of work on neuromonitoring and neurologic loss post-op or deficits post-op, and also PJK analysis. We bring them, which we're very proud of, 1,500 patients with 300 variables, and we're so proud of that, because like in a standard analysis, that's like, there's not many centers in the country in a 10-year period that can present, computer scientists or engineers that data to analyze.
Wow.
They laugh at us. They're working with 100,000 patients with 10,000 variables each. That's their big data. Our big data is baby tiny data. Still at this point. So we're still in our infancy of that, but we're going to get better, right? We're going to continue to increase the data pool, the data numbers, and then again, as you know, the more data, bigger data you have, the better the statistics become, and the more program and track will become to figure out exactly what's important pre-op, intra-op, and post-op. That's what's going to change in the next 10 years. It's going to change rapidly because the analysis part is already there. That's doable. We just need more data and bigger data to make the analysis more powerful, more statistically powerful.
Makes sense.
Spinal deformity surgeons, I mean, people who take care of spinal deformity patients are really, it's a special breed. I mean, they're unique patients. It's just a privilege and honor to take care of them and to help lead our profession get better. And there's a lot of people that are working hard for this. So, I mean, obviously I've been very fortunate to be part of the leadership of this profession in the last 30 years or so. But, I'm only one small cog, and there's so many others that have taught me so much as well. And so we're all in this together. And that's why we're here at this meeting. That's why these meetings are going to continue. We have a lot more to learn. And, until we can have 100% successful spinal deformity surgery patients without complications or revisions, we'll end this meeting. And that's going to happen anytime soon. But we're making nice, slow, steady progress, and that's why we're here.
It's the pursuit of that.
Pursuit of that, exactly.
You may not even ever achieve that.
The pursuit of perfection, leads to excellence, right? That's right. Vincent Lombardi, someone close to that quote, I think he said that. But that's how you get excellence, is pursuing perfection, right? So we won't get to that, but we're going to get much better because that's our goal.
It seems that's the uniform, whether it's industry,
right?
Exactly.
Your colleagues. That's not only as surgeons, right? It's our your nurse practitioner, our nurses on the floor taking care of these patients. Yes. Our surgery colleagues supporting this meeting, supporting the technological advances that are giving better care to our patients. So everyone's part of this. It's pretty neat to see, and it's come together really well the last 3 decades. I've been just privileged to see this. 30 years ago, spinal deformity was being done, but it was being done by disparate groups, and no one was really focusing on it. There was certainly no meetings like this ever even in consideration, right? But even in the last 10 years that we've had this meeting, it's changed so much. I mean, this first meeting in Chicago we had 10 years ago, we had 40 attendees, and we have 320 people here today. And again, the quality of what's being presented now is it's light years.
But it's not that long ago. 16 years ago, they were doing that versus what we see now. Inner bodies, all sorts of different...
personalized implants, everything, yeah. I mean, personalized medicines. It's right. Another medicine change. Everything's going to be much more personalized in some level. But again, right now, we see patients through a Grateful Patient Grant, everyone gets analyzed from a physical therapy perspective. They get a personalized fitness program that they're given. And obviously, we have to track, make sure they do it before surgery to optimize their health and conditioning. I mean, that's kind of personalized care on all levels, not just, for every component to this surgery, from preparation, performance, and recovery is going to be prescribed like that on a very personalized level. That's how we're going to move the needle.
It's fascinating.
Right?
Thank you so much for the time, and thanks for the invite for being here.
You're welcome. My pleasure.
Look forward to seeing you.
You too.
Yes, sir.
Thanks.